Excellencies and distinguished guests, fellow speakers and participants of this third Pharma Logistics Africa Forum, good afternoon to you all. It is my pleasure to join you to reflect on one of the pillars of the health systems, which is access to medicines and other products. This topic is especially important in the context of the ongoing COVID-19 pandemic. The recent emergence of COVID-19 variants such as Omicron reminds us of the urgent need to address vaccine equity. We need to accelerate COVID-19 vaccine availability. We also need to accelerate its uptake across the globe. The COVID-19 pandemic challenges our creativity to invest in critical health products. It also challenges us to scale up innovative supply solutions. And this for Africa includes diversifying the manufacture of therapeutics, vaccines, and diagnostics. I take this opportunity to thank the Great Rift Valley for the invitation to this important event for WHO Regional Office for Africa. And today I will focus on 3 areas related to essential medicines and other health products in the African region. First, the inadequate availability and affordability of essential medicines in Africa, and generally issues hampering efficiency of the supply chain. Secondly, I also want to reflect on the negative impact of COVID-19 on the supply of essential medicines and other health products. And finally, I will talk about new developments on local manufacturing and propose a way forward to create a robust pharmaceutical system in Africa. Excellencies, distinguished guests, ladies and gentlemen, I am very happy to note that all African member states have prioritized access to essential medicines and health products, and they have done this in various ways, including developing evidence-based national medicines policies and also having national essential medicines list. We have also noted some improvements in availability and affordability of some essential medicines, which has come with a strong political engagement. This is particularly true for communicable diseases like tuberculosis, HIV, and malaria. Despite this progress, the overall availability of essential medicines in Africa remains inadequate. And I'm sad to say that many life-saving medicines are not adequately accessible or affordable to majority of the populations in Africa. Sometimes the price goes up to 6.5 or 13.8 times more compared to international reference price for some medicines for non-communicable diseases. And often, African countries end up in the back of the queue for new technologies, including vaccines, as we have seen during this COVID-19 pandemic response. Ladies and gentlemen, with so many lives at stake, healthcare workers and patients in low-income settings need to have access to life-saving medicines and health products. So, what are we doing about this? The World Health Organization has stepped up its efforts in creating a healthier market to ensure that when an innovation is available, it can be made financially accessible in the African region and all other regions. It is anticipated that the pooled procurement mechanisms, for example, what has been established by small island developing states that we refer to as SEEDs, and also by the Southern African Development Community, SADC, these kind of initiatives will reduce the prices of medicines by 40%, and this will result in significant improvement in availability. Your Excellencies, distinguished guests, ladies and gentlemen, the ongoing COVID-19 pandemic has really exposed the extreme vulnerabilities in the supply chain in Africa. Countries in our region rely on imports that account for 70 to even 100% of their demands for medicines, vaccines, and other health products. COVID-19 has emphasized more than ever the difficulties in maintaining a continuous supply of health products in Africa. During this period, border closures and protective measures have also imposed export restrictions and have increased delays and disruptions by 40%. Even if a supplier is identified, the prices of these products have increased due to market inflation being at least 5 times more expensive in volume than in Europe and North America. The variation in prices between countries adds to the complexity of the market. To respond to these and other challenges, I believe that there is a strong commitment in Africa to boost local manufacturing. African leaders have already identified the need to develop this industry through various mechanisms. For example, the adoption of the Pharmaceutical Manufacturing Plan of Africa and the Business Plan. Expertise exists among manufacturing entities in African countries. On its part, the World Health Organization has been working with manufacturers in countries, and here I would like to particularly mention Ghana and Kenya, where there has been work to improve manufacturing and pre-qualification capabilities for pediatric anti-malarial medicines. 5 manufacturers in Kenya, Senegal, South Africa, Uganda, and Zimbabwe have achieved the WHO pre-qualification standard. Despite the huge potential for local pharmaceutical production in Africa, we still have many known and unknown challenges that will need to be overcome. These include low patronage, high cost of production, high dependence on imported inputs, inadequate incentives, inadequate capital, and high commercial interest rates from banks. Others to add to this already long list include low levels of exports and lack of policy framework for pharmaceutical trade in some countries in our region. As WHO, we are working with countries to strengthen regulatory systems towards manufacturing excellence. This includes establishing the African Medicines Agency that has been done by the African Union, for which the treaty entered into force on the 5th of November 2021. We also have examples of strengthened regulatory systems in countries. For example, Ghana and United Republic of Tanzania have achieved maturity level 3 as per WHO's recognized standards for regulation of medical products. Many other countries are also very close to achieving this maturity level. Ladies and gentlemen, in line with the World Health Assembly resolution on local manufacturing, we are happy to note that South Africa launched the Messenger RNA Technology Transfer Hub in June 2021. We are also happy to note that Rwanda and Senegal also engaged in partnerships for technology transfer to produce vaccines locally. All these are very important developments for Africa, and we really look forward to many, many more such initiatives. To end my remarks, I would like to reiterate that it is time to collectively create a robust pharmaceutical system in Africa. We really need to ensure that life-saving products are available to everyone and not just to those who can afford to pay. We can start by empowering local manufacturers to improve access to essential medical products. We can also shape the pharmaceutical market to what we want for our future. The new normal will require us to strengthen leadership and governance for a resilient pharmaceutical sector and its management cycle. Your Excellencies, distinguished guests, ladies and gentlemen, I thank you for listening.